5 all-natural methods to lower blood pressure. Reduced alcohol consumption, low sodium eating, and aerobic activity are all beneficial. In the US, 1 in 3 persons suffers from hypertension. Are you aware of your status among them? Because it rarely causes symptoms, this illness, which results from too much blood pressure pushing against your artery walls, is referred to as the silent killer. High blood pressure, sometimes referred to as hypertension, can harm your arteries and greatly raise your risk of heart attack, stroke, heart failure, and kidney failure if left untreated. According to preventative cardiologist Luke Laffin, MD, blood pressure treatment is frequently 70% lifestyle and 30% drugs. Your meds won't work as well if you use blood pressure medication without changing your lifestyle. How to naturally lower blood pressure. The term, lifestyle changes, infers that you'll get to alter your whole life to bring your blood weight down, but indeed little changes can go a long way, and over time, you'll be able to construct up to making larger changes. 1. Eat less salt. It's debatable whether your salt intake affects your blood pressure if you haven't been given a hypertension diagnosis. But pay attention if you've already received a hypertension diagnosis. According to Dr. Laffin, reducing your salt intake is likely the most effective strategy to lower your blood pressure. A low-sodium diet actually has the same impact on blood pressure as 1.5 to 2 blood pressure drugs, according to research. The American Heart Association, AHA, advises against consuming more than 1,500 milligrams, or roughly 1 teaspoon, of salt per day, whereas the average American eats 3,500 milligrams on a daily basis. 2. Increase potassium intake. Because it aids your kidneys in eliminating extra salt, potassium can help reduce blood pressure. And as you just discovered, a reduced sodium intake corresponds to a lower blood pressure level. Blood pressure rises when there is an imbalance between potassium and sodium. Fast food, processed foods, carbs, potatoes, and meat are all likely to be abundant in a diet that is low in potassium, which raises the risk of high blood pressure. Instead, make an effort to consume 3,000 to 3,500 milligrams of potassium daily by eating things like bananas, tomatoes, avocados, cantaloupe, carrots, grapefruit, kiwi, beans of Lima, nectarines, spinach. But there's a significant catch. If you have kidney disease, watch out for potassium intake as your kidneys might not be able to eliminate it. 3. Follow a DASH diet. Dietary approaches to stop hypertension, or DASH, was developed expressly to lower blood pressure. The evidence supporting this diet is actually so compelling that it is now regarded as one of the most significant non-pharmaceutical approaches to treating hypertension. The DASH diet, according to Dr. Laffin, is a well-balanced eating plan that is high in fruits, vegetables, and whole grains and can be used with a low-sodium eating plan. It can be quite beneficial to lower blood pressure, particularly when you work with a dietitian or nutritionist to go through the fundamentals. 4. Take action. Dr. Laffin cautions that being sedentary, or not exercising, might raise blood pressure. Therefore, turn on Olivia Newton-John because it's time to move. Exercise, especially aerobic exercise, has a remarkable ability to lower blood pressure. Your blood vessels must expand and contract as a result, keeping them flexible. Along with other advantages, it also promotes the growth of new blood vessels and boosts blood flow. There are also isometric resistance workouts and dynamic resistance exercises, such as weighted bicep curls, like wall push-ups. 5. Get to a healthy weight. Your blood pressure rises along with your weight, so decreasing even a few pounds can significantly lower your systolic blood pressure. According to Dr. Laffin, the fat cells that form around our midsection are physiologically active. They release a variety of hormones, which eventually cause blood pressure to rise. Of course, the solution is rarely as straightforward as just lose weight. Numerous medical and lifestyle-related issues come into play when discussing the subtle and complicated subject of weight. Additions to the advice. While there is less proof of these guidelines' direct effects on blood pressure, Dr. Laffin nevertheless offers a few more that he believes are crucial. Give up smoking. High blood pressure and smoking both damages the lining of your blood vessels. Smoking can be a difficult habit to overcome, but it'll do wonders for your overall health. Spend enough time sleeping soundly. Lack of sleep has several alarming implications for your health. We now know that wildly fluctuating blood pressure, which is just as harmful as high blood pressure, may be avoided by getting 6 to 8 hours of unbroken sleep each night, according to Dr. Laffin. Become less stressed. He continues, chronic stressors can affect lifestyle aspects that are crucial for your blood pressure. Chronic stress or anxiety can make it more likely for you to make poor nutritional decisions, get less sleep, and engage in less physical activity. Watch for more informative videos. Please subscribe and like our YouTube channel at Brighter Health Info. Also visit our website www.brighterhealthinfo.com and press the bell icon.